Have you ever asked your doctor how much a test or procedure is going to cost you? Well, Diane Atwood, who writes the blog Catching Health, is here to tell us why we should. Diane, I've tried to do this. It's not as easy as it might seem.
No, it's very difficult because doctors often have no idea how much something costs. But still, you should ask because after all, we are paying for our health care through our premiums and our out-of-pocket costs. I talked to Dr. Brian Pierce yesterday. He has a primary care practice in Rockport. He commented on a recent blog post that I wrote on this issue. So I called him up, asked him what he thought about patients asking about cost. He said patients should be asking their doctor how much something might cost. He pointed out, though, that in health care there usually isn't just one set price. Some examples. There's the sticker price or the retail price. It's the price that the provider or the hospital sets. No one usually pays that price except maybe somebody without insurance. There's the negotiated price. Insurance companies negotiate prices with care providers. That same insurer may pay different amounts to different providers. There's Medicare and Medicaid prices. Now, there's usually no negotiation. They establish fee schedules. But like the insurance negotiated rates, they're generally a lot lower than sticker prices. And then there's the discount price. Some providers will offer a price reduction, say if you pay within a certain time period, or if you ask to negotiate. Yes, negotiate. Dr. Pierce says it may be more difficult to do for an office visit because you are paying for a person's time, but you may be able to negotiate the cost of a test or a procedure. And if you're able to pay cash, ask for the negotiated or the Medicare rate. A friend of mine did that recently in Florida, and she paid the much lower Medicaid rate for an eye procedure. So, deep breath. A lot of information. And there's so much more that I could be telling you, but if you go to my blog, Catching Health, and look for the post about asking your doctor how much, you'll find a list of online resources that will help you research prices. Be warned that even on those sites it can be confusing, but you should be able to get a rough idea. Do your research, then share that information with your doctor. And while you're discussing prices, you should also be asking why a certain test or procedure has been ordered. You'll learn more about what else you should be asking on the Catching Health blog, and be sure to subscribe to the blog while you're there. Thank you.
So yeah, gone are the days of being a passive patient. When it comes to both care and money, you have to be a little bit, I hesitate to use the word aggressive, but a little aggressive,
you have to,
assertive.
You know, for everything else, we know what the price is up front. For our healthcare costs, it's usually when we get the bill after the fact, and you can get a lot of sticker shock, they call it too, when you find out. And it's one of the leading causes of personal bankruptcy too, people who cannot pay their medical bills.
All right, so try to find out up front.
Start the conversation.
There you go. We're right back right after this. Don't go away.